Population genetics is going to change primary care by allowing our patients to come in the door with an understanding already of what they may be at risk for. Right now, as an individual goes to their general practitioner and comes through the door, they have ideas of how to treat that individual, but they're based on a very bland and standardized way of, you get your colonoscopy at 45 to 50, you should be thinking about these types of things for heart risk. Precision medicine and population genetic health is going to advance that by allowing physicians to tailor the treatment path or tailor the recommendations for the individual, not just based on a broader population, but specific to that individual. In traditional genetic testing, back when I got started in the field, it was kind of a one and done mentality. We send a sample into the laboratory, that sample is tested for one specific condition. Population genetic health testing is similar in that you will get an initial readout on the conditions that were tested for, but 10 years down the road, you may present back to the clinic with a new situation, a new ailment. And instead of them having to go and try and identify, what's the very specific test that we should order to try and identify the condition, the data is already there. And all they have to do is run a new query against existing data and have that repopulate into the EMR. So having all of that data and all that information in the EMR will help us pull forward an idea that we've been calling sequence once, query often. And that sequence once will happen in one time point, and then we will query that data set over the lifetime of the patient. I'm so excited about having individuals learn about genetics and genomics long before they even realize that they are at risk for a certain type of condition. And we've clearly identified a number of people who are at risk for either hereditary breast and ovarian cancer, colorectal cancer, or familial hypercholesterolemia. Building a population genetic program at an academic medical center is really, it's a challenging and daunting task. And even a really large academic medical center like ours would struggle to build everything ourselves. Partnership with Helix has really allowed us to focus on the piece that we do really, really well, which is communicate results to patients, help patients take the next step in their care journey based on their results. Helix has created a platform that gives us access to high quality, low cost, rapid technological platform access. So doing all of that on our own, we can't do it at cost and at scale. And so with partnership with Helix, we've really been able to broaden our scope from maybe 100 patients to 100,000 patients. I think the time is right to begin offering genomics. The insights that we are capable of making now are impactful and important.